Welcome to the CommonWell Health Alliance Nationwide Coordinated Care Interoperability Showcase. We are featuring 7 of our members here where you'll watch the care transitions nationwide. Today, what you're going to be seeing is not just a demo, and it's not just a presentation we created for the show today. It's actually something that is happening nationwide with our services and connectivity every day across the nation. As we share on this slide, CommonWell is a not-for-profit trade association made up of organizations and open to organizations who are committed to our vision of ensuring that the data is available to individuals and the providers, regardless of where that care occurs, that the provider's access to that data must be built into the software at a reasonable cost and by a broad range of providers and the individuals that they serve. As I mentioned, we are an organization and we have about 80 members today that are representing well over 20 different care settings. 7 of them are here with us and are going to be showcasing their CommonWell services in 6 different venues of care, all working together to hope to improve the outcomes nationwide. So, in our story, you're going to meet David. He is a 43-year-old gentleman who lives in a small town of Covington, Washington, and he is pretty good about going to his PCP and getting his annual checkups, but he's working a pretty stressful 60-hour-a-week work job. I know some of us can relate to that, and he hasn't been taking care of himself. And during this checkup, he's going to unfortunately see some health issues that are going to take him on a little health journey that he wasn't really anticipating this year. So in the span of about 20 minutes, we're going to cover 10 months, 3 towns, 2 different states, and providers who are spanning 2,000 miles. And we're going to be showcasing CommonWell services in action. So you're going to see our patient identification and linking. You're also going to be seeing our record locator, as well as our federated data query and retrieve broker. And you'll see that's all built on this consistent governance foundation that is helping our members adopt the services, but also helping us safely transfer demographic and clinical data while never storing any of that clinical data itself. And the things to really watch out for, so the features that we think are super unique are correlated linking. So you're going to see in all of our care settings that once they're linked, they're going to be able to get access to the patient records, even prior to when that patient is being seen by them. They're going to have something new to CommonWell, so we're featuring event notifications, and in this case, it's provider care notifications, which means that when a patient is admitted, discharged, transferred, the PCP in this case will actually get an outbound notification from the acute facilities letting them know that their patient was transferred and was also discharged from those organizations. We will feature FHIR, both in our home care and our MediCheck acute location. And OneRecord will be shown within their PHR direct consumer access to be able to access those records. And finally, and probably the wow factor that we hear from our providers really is the fact that the technology is built right into the software so that there's no workflow changes. They're going in the same software that they've been using for their electronic health records and getting access to that data right within their own workflow. And really, it's about putting the patient at the center of care. We're trying to help inform those better care decisions, reduce readmissions, decrease the total cost of patient care while improving provider satisfaction and increasing the patient experience. Because honestly, I don't know about you guys, but when I'm sick, I do not want to be carrying my health records or trying to recall the last time I had some sort of test or immunization. So this hopefully will allow people to just go live their lives and hopefully allow us to coordinate their care. So with that, I'm going to transfer it to my friend Pooja at eClinicalWorks, and she is going to take you on the journey with David. So if you want to turn around, that would be great. Thank you.
Hello, everyone. I'm Pooja with eClinicalWorks, and I'm representing Dr. Robert Henry's practice, who is David's primary care physician, located in Covington, Washington. And I would start with the check-in process. So at Dr. Henry's practice, once David comes in to get his annual physical done, as a part of the check-in, he consents to have his clinical information shared with CommonWell Network, and which is a part of HIPAA agreement at the practice. And he wants to have his information shared, both sent and received, with the CommonWell Network, which is what you were able to see here right on the screen, that David has agreed to send and receive the information with all the participants in the CommonWell network. Now that David has signed this consent, he's been enrolled into the CommonWell network, and here is where you're able to see David's information in the network. This is David's demographic information. In the middle of the screen, you're seeing David's CommonWell record, and at the bottom of the screen, you see the links to the various locations that David would have been to, which are the practices that are participating in the CommonWell network. As the last part of the check-in process, now I'm going to arrive David for his appointment to see Dr. Henry and get his annual physical done. So as soon as I click OK on the appointment screen, from the back end, there is a query retrieve transaction sent to the CommonWell network. So by the time Dr. Henry sees David, he would have all the latest documents available from various external sources for him to review in this patient external documents screen. I'm not going to focus on that. For this specific use case, I'm going to focus on his annual physical information. So here, as you can see in the progress note, David is taking Zyrtec as a current medication. He's allergic to Rocephin. And while taking his vitals, we are seeing that he's got pretty high blood pressure, so he's diagnosed with hypertension. Dr. Henry prescribes him lisinopril. Once Dr. Henry is done charting the note, he's going to lock this progress note. And as soon as this locking takes place, this document or the progress note is available for all the other CommonWell participants to be queried and retrieved and see this information through our 2.1 CCDA document. Now I'm going to hand this over to Tom from Elkay to continue with David's journey in this use case.
Thank you, Pooja. So actually, before we continue with David's journey, it's important to know that the local community hospital in Covington, Washington, that he had been seen at, has recently switched from their older EHR to MediCheck. Now, when that happened, the data was archived into the Elkay Archive. So now, from within MediCheck, the provider can securely access the historical data from the previous system. The data can be imported directly into MediCheck from the archive, or you can view it directly in the archive dashboard here. So anyone that has access to the Elkay Archive can see important legacy data that will be able to make them give a more complete diagnosis more quickly and accurately. So if we look at the data here, the Elkay Archive securely stores the data and sorts it by module. Some of the important data elements that were brought over are problems information, some lab results with the attached HL7 file that was sent over through the lab, any images, documents, patient notes, or encounter notes that were in the system. And then in David's case specifically, we'd want to look at two modules. The first one is the family history, where the provider would be able to see that his brother has had a stroke in the past. And then we would also want to go to the allergy section. Now we can see that David is allergic to latex. Now this is important to know because this is not currently captured in his chart. This actually happened years ago during an ER visit for stitches in the legacy system. So now that the caregivers know that David's allergic to latex, it's important information for them to know. They'll be able to use non-latex products in order to make sure that David doesn't have any additional discomfort aside from what he came into the ER for. So now to continue David's journey, MediCheck will be able to show you the data directly in the system.
Thank you, Tom. Hello, my name is Steve, and I'm with MediCheck, and I'm going to pick up David's story 3 months later when he wakes up on a Saturday morning with an impairment of slurred speech, a severe headache, and an impaired gait. So his wife calls 911. He goes to the MediCheck Covington Community Hospital ED in order to be registered, and upon arrival, we have David registered within the ED. And because he has already been to this hospital and he's already now associated within CommonWell, we have the capability to fan out to find information about David already so we can start to treat him right away. We're using HL7 Fire in order to be able to retrieve his documents throughout the CommonWell network. So what I'm going to do now is show you on David's chart how we have been able to now retrieve the documents from both his primary care visit with eClinicalWorks and also through the Elkay Legacy Archive. And it's important that we're able to retrieve this information, such as the problem of hypertension that was noticed, that was recognized with his primary care, and also the medications that he was on, such as lisinopril, because what this allows us to do is have this information front and center, because David can't speak for himself. We also have the capability to pull from the archive of Elkay, as I noted, and the allergy of latex is also noted here as well. So I have the capability, because I'm using a CCDA document, to be able to actually reconcile this information directly into the chart at the same time. So in this instance, I'm going to reconcile the latex allergy in order to pull it into my chart and have that information now readily available to me as a clinician to be able to see that. Moving forward with David's care, we have ordered a CT scan on him and have determined that he is suffering from a stroke. So we actually now have that noted within our problem section. At the same time, we also have the hypertension noted as well as a problem that we brought forward from his primary care physician visit earlier. Due to his condition, we have ordered Alteplase as a dose to be given to David to help stabilize him, and we also have noted the active medication for the lisinopril. Now that David is stabilized throughout his visit, we're now going to discharge him. And it's important to note that during the discharge, we are automatically creating another external medical summary that can be shared throughout the CommonWell network as David continues his care. And at the same time, we're also creating an event notification, in this instance, a provider notification that will be sent back to his primary care physician with eClinicalWorks, notifying the primary care physician that David has had a visit with us. I'm now going to turn the story over to Jonathan.
Good morning. My name is Jonathan Aladis, and I'm with Cerner, and I'm representing the inpatient setting today using Cerner Millennium. So David is having a rough time right now, and he's been transferred over to the inpatient setting for additional evaluation after his stroke. He gets admitted to the neurology floor in Seattle, and he's placed on heparin and Coumadin. He's also ordered an MRI so that they can check on the clot and any further bleeding. As you can see on this screen, as a result of the patient linking that occurs within the CommonWell Record Locator service, I'm able to see information from disparate sources that are within the CommonWell Health Alliance. So I get information from the primary care physician, information from the ER, and I can better take care of David going forward. So this screen shows you information that I've stored within the local record itself. So things that I've charted within this inpatient setting, as well as information that's coming from the external sources. As a provider, if I'm interested in consuming that information discreetly, all I need to do is click on the row. You can see the purple indicator showing that this is from an external source, and I can simply consume that and add that to the chart directly. From that moment henceforth, that information is within the inpatient's chart, while also saving the provenance. So as a provider, I know where that information has come from. Now, we're not only just referring to continuity of care documents, but also those important narratives like your progress notes, HMPs, and other pieces. After a 5-day inpatient stay, David is going to be transferred over to the home health location, which Carrie will talk about. In order to facilitate that, I send a direct message to the home health informing them about information that David has. I attach an important face-to-face document, which helps them with David's care moving forward. As with the ER, something that also happens on discharge is that a notification is sent back to the primary care physician, so they're notified about David's status. So as a quick recap, what you've seen is patient linking in CommonWell so far. You've seen the consumption and retrieval of information from other sources. You've also seen the use of direct messaging to the home health, as well as event notifications back to the primary care physician. I shall pass it back to Pooja, who's going to take you through the receipt of the notification before we move on to the home health space.
Thank you, Jonathan. So, as Steve and Jonathan mentioned about the event notification, being the primary care physician, Dr. Henry is now able to see those event notifications in the transition care management area. Here are the 2 events that have been registered. This patient has been discharged from both these places, and you're able to see the details right here on the screen with the latest diagnosis. Dr. Henry can schedule a follow-up appointment with David and continue with his care. To continue with this use case further, I'm going to pass this on to Carrie from Brightree, and she's going to start.
Hi everyone, my name is Carrie and I'm here with Brightree representing the home health part of David's story. I'd like to mention here how exciting it is that we have this notification process back to the doctor every step of the way. Many times physicians in the community are completely unaware of the fact that their patient has been in the hospital, much less the details of what have gone on and those types of things, and that they need a follow-up visit. So this is very exciting news. It's something that home health agencies often have to follow up on. So this just makes our process much easier. So picking up the story, David's been transferred to home health from the Baseline Medical Center, from Cerner's Medical Center, through a direct secure message, CCDA, HL7 CCDA. It comes right into our system. Our system is able to digest much of this information, and the intake coordinator, clinician, is able to do some reconciliation and determine what things that they'd actually like to pull into the system. So this is what the CCDA looks like when it comes in. And there's a lot of information here on that CCDA. In addition, there's some discrete data that's embedded in that CCDA, which we use to link to the CommonWell network, and that's called correlated linking. Once the patient is linked, Bright uses HL7 Fire to do a query up into the CommonWell network and pull down a list of nationwide encounters and documents that are available within the system. And so because it's a nationwide encounter, they're able to pull those documents back, look at them, determine what would be pertinent to the patient's care, and save them to the system as needed. The ability to access the nationwide patient encounters and associated documents potentially really helps prevent hospital readmissions and increase positive patient outcomes. After 6 weeks of care and rehab by his home health team, supported by the information from all the other providers within the CommonWell network, David is no longer homebound. He's doing much better, and he discharges from home health. Later that year, David wants to move closer to his family and relocates to HIMSS, Texas, a Fort Worth suburb. I'm going to pass the microphone over to Kate here from OneRecord, who's going to take over the story from here.
Thank you, Carrie. I'm Kate. I'm with OneRecord, and I'm representing David as the patient, as the healthcare consumer who wants to get access to all of his health records that have been generated by these various systems through his episodes of care. So now that David has moved to Texas, he's looking to establish a new PCP. So the first thing that he does to prepare for that visit is sign into his OneRecord account and view his existing health records. Because David's OneRecord account is linked via the CommonWell network, he's able to query for and retrieve the records via the CommonWell network using IHE XCA transactions from his former PCP, his ED visit, his hospital visit, and his home health visits. OneRecord automatically imports clinical items from those retrieved CCDs into his aggregate health record. So we can take a look at his conditions and see his diagnosis of hypertension as well as his episode of stroke. And we can take a look at his medications. Items that are duplicate of existing clinical items that have been previously imported via FHIR, via manually uploaded CCDs, or via past queries to the CommonWell network are automatically ignored, and potential duplicates are flagged for David to review. David can review and reconcile those duplicates, keeping the new items that were imported via the CommonWell network. As David continues to prepare for his visit, he notes that he's stopped taking his allergy medicine for molds now that he's moved out of Washington State. He makes a note of this in his OneRecord to discuss with his PCP at his upcoming visit. And now that David has made that correction in his OneRecord account, systems that pull this record in the future will be able to see the modified data. Finally, David reviews the full list of files that were retrieved via the CommonWell network, and we can see that he now has access to full summaries from his former PCP, his ED visit, his inpatient visit, as well as his home health visits. So I'm going to pass this over to Corey at Greenway Health to continue with his new PCP visit.
Thank you, Kate. Well, good afternoon, everyone. My name is Corey. I'm with Greenway Health, and today we're going to be playing the role of David's new primary care physician that he's going to establish a relationship with in Texas. So what we've seen at this point is our patient go through a pretty invasive medical condition. This has taken place over multiple care settings across many different service locations. And now that he has aggregated his data together in his personal health record that we just saw, he wants to go and make that relationship with a new primary care physician so that he can continue progressing forward. So he makes that appointment at a local provider organization who is already enrolled in CommonWell. As we've seen up until this point, the big benefit of the CommonWell services is the fact that it can be directly implemented into your product. So right here, using the Greenway Energy platform, we're able to launch a CommonWell application that uses a Fire API transaction out to the network, checks for different things such as the enrollment status of the patient, as well as different network links that may be available. Now, at this point, we are able to see all of the different past care organizations that this patient has been to throughout this use case, OneRecord being one of these. So the provider knows at this point he wants to go and try to look for a document available for that personal health record. At this point, we can go into a document retrieval screen, and this sends out what's called a cross-community access or XCA query transaction that we've seen throughout this use case. That's going to look throughout the network as it federates out into the different locations that it has recognized, look for available documents and pull those into this list that we have here. And then a separate transaction called XCA retrieval transaction takes place to pull those documents in. At this point, we're going to go to the patient-generated document because that's going to be the one coming from his personal health record. That's going to perform a subsequent XCA retrieval transaction. It's going to pull that data in, index it here on the right, and at this point, the provider has the ability to go and jump, say, directly to the medication section, and we can go through that past medical history there. The provider also has the ability to save this directly to the chart, so we don't have to go into that retrieval screen each time and keep sending off those transactions. So the provider pulls that in, does a review of the medical history, and he does a current physical exam, and he does see that the patient is progressing with his care. So he schedules a follow-up appointment in 6 months just to follow up and make sure that he continues that progression.
So just to follow up with what you saw today, we had a smooth nationwide coordinated care using CommonWell, and we really empowered the patient and the provider to provide that care. And it was really thanks in part to the CommonWell nationwide network of services like patient ID linking, record locator, federated data query, and retrieve broker. But it's really also a large part of our members building this seamlessly into their software and delivering it to their providers. You saw correlated linking in action, provider event care notifications, FHIR, direct patient access, and again, all that technology built right into their software. So that really the patient is the center of care, and that we're all focused at David was the priority when he was getting this health issue that he wasn't expecting. As I mentioned at the beginning, this is not something that we just created for this demonstration here or for the event. We have more than 11,000 provider sites live in the U.S. at every state in the U.S., D.C., Puerto Rico. I know some of our Puerto Rico friends were here today. And we're connecting all of those records really with the point of making sure that that data is seamlessly delivered. So really appreciate you coming and stopping by the nationwide coordinated care use case, and we'll be happy to take any questions.